Hi, today we're talking with Mari Kaptain-Dahlen, the CEO of Siouxland Community Health Center, about responsible reporting of healthcare information and data. Mari, can you tell us a little bit about your organization?
Siouxland Community Health Center is a federally qualified community health center, which means we have federal dollars from HRSA, our funding body, which allows us to take care of people who are marginalized, underinsured, or uninsured. So our organization annually sees almost 30,000 unduplicated patients. Our services include dental, medical, behavioral health services, as well as services for patients with HIV/AIDS, and also those individuals who are in search of a Title X or family planning services. So we have also a in-house pharmacy and really try to hold ourselves out to the community as a health center that provides all needed health services under one roof.
That's a lot. What's your role within all of this in your organization?
Well, I'm the Chief Executive Officer here and have a wonderful supporting team of administrative leaders and medical leaders and a wonderful, wonderful staff of 270 employees who are dedicated to our mission of taking care of patients and providing access.
With so many services, employees, patients, and bullet points in your mission, I mean, we're talking about data today, so can you tell me about the kind of data you work with in this organization?
Well, as a federally funded primary care health facility, you can imagine we have lots of data that we have to report. But we are very focused on reporting quality data and patient satisfaction data, not only to our staff and leadership team, but also to our board and then also to our patients. We try to be very transparent with our data and make sure that everyone sees that we are very anxious to improve our quality and to demonstrate that we do provide quality care.
Can you just give us some specific examples or stories about the kind of data you have and then how you responsibly report it, share it, or visualize it with any of those different types of parties, because they're all so different?
Okay, good question. One of the things that's very unique about Siouxland Community Health Center, we have for almost 5 years now been on our process improvement journey. So we feel that everything in our organization, every decision we make, whether it's a clinical decision regarding a patient, whether it's our board making decisions about capital expenditures, all need to be data-driven. So each day at our organization, all our departments and all our services start with a daily huddle. And our huddle boards at each one of our teams is filled with data. Data on what our clinical targets are for the day, what our volume targets are for the day, what our billing targets are for the day. So we start that day making very sure that everybody understands what data needs to be presented to our patients, whether it's making sure they get a colorectal screening exam, whether it's making sure that their child gets an immunization that day, all the way to how much are we billing that day and how much are we actually passing through our revenue cycle. So our daily huddle board is our chief means of transporting data and communicating data. Another thing that we do is with our board, we every month go through all of our UDS clinical measures. UDS is a set of data that we turn into our HRSA funding body, and it includes data like childhood immunizations, child weight assessments and counseling, diabetes, chronic disease management, all of these, and we all have targets that we have to meet. So what
and that's
we
very unique to the SCHC world, correct?
Very unique to the SCHC world. So our board, which interestingly has to be comprised of at least 51% consumers, spends a lot of time looking at this data and making sure that we understand where we are relative to target and what the strategies are to make sure that we meet the target by the end of the calendar year. The other thing that we do with our data, with our UDS data, is that we do publish it in our patient lobby. both on our medical floor and on our dental floor, so that people are able to see, our patients are able to see where we do well with our measures and where we need improvement. We see patient accountability as a huge part of reaching our measures. We are a patient-centered medical home, and so we really see that together with the patients, we partner to make sure that we achieve our clinical outcomes.
So accountability is a big part of responsibility in your data reporting, it sounds like. What are some ways you visualize your data or try to help tell a story while also being responsible with the bigger picture that it weaves?
So we are big into doing a lot of longitudinal data recording. So we have lots of graphs. We have lots of pie charts. Those are all hung on our huddle boards so that a patient can walk down any hall in our organization, a staff can walk to lunch, and they're going to see a visual representation, whether it's a linear graph, it's a bar graph, if it's a pie chart that talks about one data element, whether it's a clinical data element, a financial measure, or an operational measure.
Wow. So that's the way you interact with patients and staff. And then your board, is there other methods or tools that you've developed to kind of help educate your uniquely consumer board to help understand your healthcare data and how they can engage with it?
Well, one of the things that we learned early on, that for all of us, the data becomes so overwhelming that if we just color code with 3 basic colors of red, green, and yellow, we seem to do a lot better. So a lot of the dashboards that we do for our board are color coded. We give very in-depth financial information to our board every month. We have a monthly financial report, and that dashboard is all color coded. So they can see what the operating income was for the month, what our net patient revenues were for the month. Then we do a series of ratios for them, financial ratios, so they can look at days cash on hand. They can look at net days receivable and our net accounts receivable. They know our days in accounts payable as well. All of that is done on the dashboard.
Which form of reporting or visualization do you feel like they respond the most to, that kind of helps guide them the most and they get excited about?
Well, they love our clinical dashboards. They can see those in red, green, and yellow because the importance for them is knowing that we're making a difference in patients' lives. Where they can see very visually a 2-year-old has received all the immunizations that they're supposed to have, and we've really started that child well into their social and emotional and physical development. I think the other thing that's really important for them is to see that, particularly with our dental patient self-management goals, that patients are taking accountability for their oral health and that are really working with our dental team to make sure that they're achieving same-day sealant objectives, oral hygiene objectives, et cetera.
That's great. Well, I mean, Siouxland Community Health Center is such an innovator, especially in the SCHC world, and you work with so many different moving parts. What is kind of the next step or something you see on the horizon for how you use your data, how you report it, and where you're going with everything?
So Siouxland Community Health Center is a part of Iowa Health Plus, which is an accountable care organization consisting of 11 FQHCs across the state. And as members of our ACO, we are very, very focused on how we can present our data and use our data to make good clinical decisions. We are all participating now in a data analytics implementation that really consists of 2 new software installations. One will be a business intelligence tool. The other, which we're really excited about, is a care coordination and a core management software system. And there are all kinds of visual data that we can provide to not only our providers and their teams every day, but we can also hand directly to our patients. And it's a dashboard that shows them on a red, green, and yellow report where they are meeting their health objectives and where those gaps occur and how we can work to close those gaps. We are also excited about this tool because it will be a very transportable way that we can interact with our patients. We're really hoping that not only we give them a piece of paper, but that someday we can put that on a phone app for them and they can just bring that up every day and monitor their health.
That's really exciting. I can see how responsible data reporting is so critical to patient accountability in your organization. How did you even, as we wrap up, come to decide that this would be something that'd be guiding you as you implemented your leadership vision?
For many years, we have seen the importance of doing process improvement work, and that people, if they experience a process as a patient that's very frustrating for them, or if staff find inefficient processes, we have to have the data that help us make decisions to make those changes. And without that data, we're just going on gut feel and assumptions. So we strive every day to make sure that data really does drive the decisions that we make, that we're making good business decisions and we're making good patient care decisions.
Mari, thank you so much for sharing this experience with us today, and we really appreciate it. And thank you to Siouxland Community Health Center.
Thank you for allowing us to participate.